Thank you, Dr. Deepamala. Today, our moderator is Dr. Binoy Abraham from USA. Yes, Dr. Binoy. And we can't hear you. Please make.
Yes,
Yes,
it
yes.
has
Now it
been.
is visible. No, no.
Yep. Today, the 2146th day of uninterrupted daily webinar of IFPH. And let us have a moment of silent prayer before we start. Thank you. Today's our guest is Dr. Minal Arun Trivedi, BHMS, retired medical officer, Rajkot Homeopathic Medical College, and Sainath Homeopathic Hospital, Rajkot. The topic is restoring the rhythm, an integrative approach to PCOS. Let's have a warm welcome to Dr. Minal. Dr. Minal, you are a host, and you can share your screen and you can start.
Thank you, sir. Can I audible?
Yes, you are well audible.
Okay, sir. Screen.
Yes, we can see.
Yes. Okay. First of all, good evening, everyone. Thank you, Dhanesh sir and IFPH for giving me this wonderful opportunity to present today's webinar on one of the most common endocrine disorder affecting women's worldwide. That is polycystic ovarian syndrome, commonly known as PCOS. We are going to understand an entire hormonal disorder that affects the reproductive system, metabolism, mental health, fertility, cardiovascular health, and all over quality of life of female.
It's outline now. It is outline. We can see the screen.
Yes.
You may not be able to see it in the screen, but you can see in your yes, the introduction. And now it is the introduction.
Before defining PCOS, let me ask everyone a question. Imagine 22-year-old female comes to your OPD with irregular periods. She has acne, unwanted facial hairs. She has gained weight over the last months or years. What diagnosis immediately comes to your mind? Exactly. The most common uh, us would think of PCOS. But why? Because PCOS is one of the commonest endocrine disorder among women of reproductive age. Now let us define it. Polycystic ovarian syndrome is a heterogeneous endocrine disorder. Heterogeneous means uh, that every patient present differently, like in our homeopathy. And characterized by hyperandrogenism, ovarian dysfunction, and polycystic ovarian morphology. So now two patients are exactly alike. Some may mainly have irregular menstruation, some may have infertility, some have obesity, other may mainly complain of acne or hirsutism, means facial hair. Therefore, PCOS is called a syndrome because it consists of a collection of various signs and symptoms rather than one single disease. Now, another important point: many people thinks PCOS is simply means many ovarian cysts, but actually that is incorrect. These are not true pathological cysts. They are immature follicles that fails to ovulate and remain arrested during development. That is why they appear as multiple tiny cyst-like structure on ultrasound. Hence, the term polycystic ovary comes. Uh, it is the uh, previously I said that it is most common endocrine disorder of women worldwide. This is the some data. now etiology. Move to etiology. There is so many factors that affect human cells, like a genetic basis being suspected, autosomal dominant symptoms. Third, twin study, like twins. One of twins baby have PCOS, then second baby have more chances to get PCOS. Dysregulation of CYP11E gene, upregulation of other enzyme in androgen synthesis pathway. Insulin receptor like means insulin resistance and decreased sex hormone binding. This is the some clinical data worldwide, and some lifestyle some lifestyle and some diet habit that triggers polycystic ovarian syndrome in young women. Etiology, other predisposing factor like family history of PCOS, high maternal androgen, onset of one type diabetes mellitus before menarche, insulin resistance, obesity, and some drugs like Velprot.
Doctor, do you find any difficulty in watching the PPT?
Yes, sir. There is
Then we can do one thing. We can share it from Binoy's phone, laptop, so that you can see it from the screen. Otherwise, you may not be able to see it.
Sorry, sir, for inconvenience.
No worries.
No problem. No, there's nothing to worry. You just wait for some time.
Yeah, we can see the diagnostic criteria screen now. So slide.
Yes, Binoy, I have sent the PPT to you so that you can share from your side. So that
Okay, sure.
doctor, please wait, doctor. I shall remove the
Sure.
screen, and so that Mr. Binoy will share it from our side, so that you will be able to talk in a better way.
Okay, sir. Okay,
Don't
sir.
get upset. Don't get upset. We can do it in a good way. Please
Thank you,
wait.
sir.
In between, you can talk on your video, doctor.
Sir, if you don't mind, can I continue with the without PPT?
You can see it from outside, so that there will not be further problem.
Okay,
No,
okay.
don't worry, because the person who is sharing may not be able to see it in the screen, so that you will be little bit confused.
Okay, okay. No,
So
no issue.
if you see, once the other person is sharing, you will be able to watch it from
Okay, okay.
and you can go ahead. Okay. You can say which are the portion and to be discussed.
Okay, sir. Okay.
You say it. It's quite common with some of us. It's not your mistake, but this thing can happen. Please, you can open your video, doctor. Yes. Which way? Yes, doctor will share it. Please wait. This is one of the commonest problems. PCOS
Yeah,
and PCOD.
this is not first time we've been having this before too.
Yes. Yes.
All right, I'm ready to share. Shall I share?
Yes. You may share.
Okay.
Okay. Doctor, which slide you want, you can say. Suggest. Yes. It's
Can you see my screen?
yes, it's visible.
Okay.
Yes, doctor, you can go ahead.
Sir, change slide to that data worldwide prevalence.
Introduction is over, and then PM.
This is all right.
Yes, yes.
Yes. Which page?
Is this
Okay.
read?
Yes. Recently, PCOS changed the name from PCOS to PMOS. Historically, PCOS has been known by different name. These include polycystic ovarian disease, Stein-Leventhal syndrome, functional ovarian hyperandrogenism, ovarian hypertrichosis, sclerocytotic ovary syndrome. Recently, that changed from PCOS to PMOS, that is polycystic metabolic ovarian syndrome. The condition was first described in 1935 by American gynecologist. Uh, present A woman presenting with amenorrhea, infertility, obesity, and enlarged polycystic ovaries. Therefore, it was initially called Stein-Leventhal syndrome, but uh, time by time it refer different name. Now, prevalence. Now let's understand how common this disorder actually is by this data. Uh, According to various studies, the prevalence varies depending upon ethics, uh, eth- ethicity and diagnostic criteria. In the United States, approximately 4 to 12% of women are affected. In Europe, that is approximately 6.5 to 8%. In some African studies, that even a higher prevalence. All over, approximately 1 in every 10 women of reproductive age may suffer from PCOS. That makes it the most common endocrine disorder. Because of changing lifestyle, sedentary habit, obesity, unhealthy diet, and increasing insulin resistance, the number of cases are rising every year. Uh, Etiology. Uh, Now, understand why PCOS is important. Many people think irregular periods are the only problem, but actually PCOS affect almost every organ and system, and also affect mentally. It affects the reproductive system, endocrine system, skin, b- uh, the metabolic system, cardiovascular system, and importantly, the patient psychological health. Many women develops anxiety, depression, poor self esteem, body image issues, stress, hair fall, etc. Therefore, treating PCOS means treating the patient as a whole, not merely regulating menstruation. This is some clinical data that shows the lifestyle and eating habits affect this and triggering this disease and syndrome. This is one of the most frequently asked examination question. There is no single cause. PCOS develops because several genetic and environmental factor interact, like family history, etc. Now move on to physiology of menstruation. If we understand normal physiology of menstruation, then we understand how it affect. If patient This is the physiology of menstruation. How follicle how follicle maturing and detach by ovaries, ovulation period, corpus luteum phase, and degenerative C luteum phase. Next. This is brief overview of menstrual cycle physiology that we all know. the main PCOS cycle. Uh, Main is insulin's resistance, that increase high insulin in body, increase and affected androgen, increase androgens that affect ovulation, and it become irregular. That also cause irregular periods, weight gain, hirsutism, and again worsening insulin resistance. This cycle is uh, the main uh, core of disease. When we treat the PCOS, this cycle, try to break this cycle, then we treat wall syndrome. Insulin resistance. Now I want to explain about insulin resistance. Now come probably the most important mechanism in PCOS is insulin resistance. Uh, I want to everyone to understand this concept clearly, because the entire disease revolve around it. Normally, after we eat food, our blood glucose rises. The pancreas secretes insulin, and that helps glucose after body cell enter body cell, where it is utilized to produce energy. However, insulin resistant, the body cell stop responding properly to insulin. Now there is not enough insulin, therefore it produces even more insulin. This results in hyperinsulinemia. Now here it interesting part is high insulin dose something unexpected. Instead of acting only on muscles, it also stimulate ovarian theca cells. Then ovary begins producing excessive testosterone. Now testosterone suppress normal follicular development, and then follicles stop growing. Ovulation does not occur, and that unmature follicle that resides in ovaries, it shows like a cyst in ultrasounds. Now ovulation does not occur, and multiple immature follicles accumulate inside the ovaries. Uh, that is the basic mechanism behind PCOS. So whenever hear PCOS, always remember insulin resistance is the central player of these clinical features. Uh, Obesity first. Now let's discuss obesity. Nearly half of women with PCOS are overweight or obese. Fat tissue itself acts as an endocrine organ. It produces inflammatory substance. These worsen insulin resistance. Uh, Higher insulin further increase androgen production. Thus, obesity and PCOS create a viscous cycle. Uh, Second, hirsutism or facial hair. An important clinical point is skin or hair part. So many patients having acne or hair fall issue, and also facial hair or hirsutism. Some cases it also present with infertility or miscarriages, obstructive sleep apnea, metabolic syndrome, and endometrial neoplasia. Next slide, please. This is some pictorial demonstration of symptoms of PCOS. Next. Facial hair, acne, acanthosis nigricans. In this body some part of body having thick skin and over pigmentation, dark pigmentation over here. Diagnostic criteria, controversy on what constitute PCOS. It is a diagnosis of exclusion. NIH includes both of oligoovulation, hyperandrogenism, and or hyperandrogenemia with exclusion of related disorder. ES, uh, clinical and biochemical signs of hyperandrogenism and polycystic ovaries. RCOG recommends and the use of Rotterdam criteria. The most common complaint is menstrual irregularity. Uh, normally, normally menstrual cycle occur every 21 to 35 days. In PCOS, ovulation become irregular or absent. Therefore, menstruation becomes irregular. The patient may present with oligomenorrhea, which means menstrual cycle occurring more than 35 days apart. Amenorrhea meaning absence of menstruation for the 3 month or more, or sometime it's scanty menstrual flow, occasionally heavy bleeding after prolonged absence of periods. Always remember menstrual irregularity is often the first symptoms noticed by young girls. Hyperandrogenism, because of testosterone level are increased, the patient develops feature of androgen excess. The most common is hirsutism. Hirsutism means excessive terminal hair growth in women following a male pattern distribution. You may observe hair over upper lips, chin, chest, abdomen, and back. The severity is the severity is commonly assessed using the Ferrian Ferrian Glove score. Another manifestation is acne. These patients usually have persistent acne over the face, jawline, chest, and back. Uh, Many patients also show acanthosis nigricans. This is a dark thickness and velvety pigmentation see over the neck, axilla, and groin. Infertility, since ovulation is absent or irregular, fertilization cannot occur regularly. Therefore, PCOS is uh, one of this. Therefore, PCOS is one of the leading cause of unavailability, infertility. Psychological features. We often overlook the psychological impact of PCOS. Many women suffer from depression, anxiety, mood swings, anger, low self esteem, poor body images. That sometimes that um, long term and persistency of these symptoms may occur in complication. It left untreated, uh, then it leads to several long-term complications like type 2 diabetes mellitus, hypertension, dyslipidemia, metabolic syndrome, cardiovascular disease, obstructive sleep apnea, endometrial hyperplasia, endometrial carcinoma. Now, let's see differential diagnosis. Before confirming PCOS, we should exclude other condition such as hyperthyroidism. It also looks like same hyperthyroidism, hyperprolactinemia. This that also causes amenorrhea, Cushing syndromes, congenital adrenal hyperplasia, androgen secreting ovarian tumor, primary ovarian failure, and hypogonadotropic hypogonadism. This is why appropriate investigation are essential for diagnosis of PCOS. Next slide, please. In now go to investigation. This is the hormonal panel, biochemical tests that include FSH, LH, total and free testosterone, thyroid function test, serum prolactin, blood sugar test, fasting insulin level, fasting lipid profile, hydroxyprogesterone cortical when indicates. Typically, LH may be elevated while FSH remain normal, resulting in an increased LH and FSH ratio. Metabolic investigation like fasting blood sugar, oral glucose tolerance test, fasting insulin level, or lipid profile uh, that helps identify the diabetes and metabolic syndrome early and differentiate from other disease. Imaging includes ultrasound is the imaging modality of choice. Polycystic ovary typically shows enlarged ovarian volume that we uh, we uh, we discussed that unmature follicles look like multiple cyst, enlarged ovarian cyst in ultrasound, multiple small follicles measuring approximately 2 to 9 mm. We can show in slide peripheral arrangement of follicles creating the classic string of pulse-like appearance. Ultrasound alone is not enough to diagnose PCOS. Must be interpreted along with the clinical and hormonal findings. In advance, we have to do histology and endometrial biopsy. Criteria of PCOS in ultrasound, how we diagnose or detect. That follicle count, presence of 12 follicle each side, measuring between 10 29 mm in diameter, and an ovarian area 5.5 centimeter or volume. Key characteristic of polycystic ovaries is gross appearance. The ovaries are typically enlarged with smooth, thickened, and avascular. Avascular means lacking of blood vessel, outer capsule. Follicular arrangement upon cross section, numerous subcapsular follicles are visible. These follicles are in the various stages of atresia and are primarily located in the peripheral part of the ovary. Key histological feature of the PCOS is the most significant features is the hyperplasia of the theca stromal cells in ovaries that surround these arrested follicles. This hyperplasia is a major contribute to the increased androgen production characteristic of the condition. How is PCOS treated? In modern management, uh, symptomatic medications, surgery and laparoscopic ovarian drilling is there, and lifestyle modification that plays a major role in treatment of PCOS, because the main cause of PCOS where I observe that is poor lifestyle habits, uh, fast food eating, junk food eating, irregular sleep cycle, stress level, and modern lifestyle that affect more. Uh, Other treatment part is there are three main approach to treatment. That conservative, that is lifestyle modification, medical management, and surgical management. Cons- uh, Conservative management, this includes first line treatment for almost every patient with PCOS, especially those who are overweight or obese. Lifestyle modification is the foundation of treatment because it addresses the root cause of insulin resistance that we discussed early. The main part of treatment of PCOS that uh, break this cycle of insulin resistance. Uh, so first we targeted the weight loss. Even a 5 to 10% reduction in body weight can significantly improve symptoms. For example, if a woman weight 80 kgs, losing about 8 to 10 kgs may help restore ovulation, improve menstrual regularity, reduce insulin resistance, and increase fertility. Uh, Second, dietary modification. Patient should be advised to eat a balanced diet, rich in vegetables, fruits, whole grain, and lean proteins, and avoid sugary drinks, refined carbohydrates, junk food, and processed and packet food. Eat more fiber that helps in improve metabolic system. Choose low glycemic index food, which releases glucose slowly and helps control insulin level. In some patient also, I said I advise that choose zero sugar food for temporary some short time period. That also helps more. Regular exercise, patient should perform one at least a half to 1.5 hour of moderate intensity exercise, yoga, meditation, walking, cycling, swimming, or what they do like. Exercise improve insulin sensitivity, promote weight loss, and also reduce stress. Stress management. Stress increase cortisol level, which can worsen hormonal imbalance. So stress relief, patient should be encouraged to practice yoga, meditation, deep breathing, that relaxation techniques for relieve stress. That all improving insulin resistance. Second, now we discuss about medical management. Medical treatment depend on the patient's symptoms and reproductive goals. For menstrual regularity, if the patient does not wish to become pregnant and has uh, irregular periods, combined oral contraceptive pills are commonly prescribed. They hereby regulating menstrual cycle, reducing androgen production, improving acne and hirsutism. protecting an endometrium from hyperplasia. This is modern management for insulin resistant and menstrual irregularity. One of the most common drug used for insulin resistance are metformin that improves insulin sensitivity. For infertility, the first line medication is letrozole. For hirsutism and acne, the symptomatic modern medicine and modern management are there, like inositol and some supplements. Now move to surgical management, that is laparoscopic ovarian drilling. It is a minimal invasive laparoscopic procedure in which multiple small puncture are made in ovarian cortex using electrocautery or laser. Uh, how the procedure destroys a small amount of androgen producing ovarian tissue. This reduces androgen level and allows a normal follicular development and ovulation uh, to resume. Um, Now move to complications. That all com- there is no slide for complication. Potential complication includes formation of pelvic adhesion and ovarian tissue damage and reducing ovarian reserve if excessive drilling is performed. Now we are go to homeopathic approach. Can you please turn to homeopathic approach? Homeopathic approach slide. Next.
Can you see?
As we discussed early, that this breaking of this cycle is main goal of treatment. Homeopathic, we are going to homeopathic approach of PCOS. According to homeopathic principles, PCOS is not treated merely as an ovarian disorder, but as a constitutional disturbance affecting the whole person. Treatment is based on individualization, like mental symptoms, physical genders, menstrual history, hormonal imbalance, family history, and miasmatic background. The objective is to improve hormonal balance, restore regular ovulation, regulate menstrual cycle, improve fertility where it required, address the patient's constitutional susceptibility. The choice of remedy depends on the totality of symptoms rather than the diagnosis alone, and rather than the depend on signs and symptoms. Lifestyle modification is the first line of treatment and should be recommended to every patient. With medical therapy is selected according to the patient's symptoms and reproductive goals. Miasmatic background of PCOS. Our miasmatic background of PCOS, uh, we all know that in homeopathy we have three type of miasm: sora, psychotic, and syphilitic. When it comes from soric elements, there is a only functional disturbance is there. There is no any pathological changes in ovaries. The only functional disturbance and irregulation of hormones is there. uh, then it uh, The psoric elements is easy to treat rather than other. Psychotic, then move to psychotic miasm. The, uh, the, uh, the psychotic miasm have overgrowth and cyst formation in ovaries, or hormonal disturbance is there is excess or suppressed tendency to chronicity is there, glandular and pelvic pathology is there. Then comes to syphilitic elements. There is the destructive changes in uh, mm, body parts like ovaries and other hormonal organ. There is also results in infertility, irreversible. There is irreversible tissue damage, and sometimes it's ovarian abscess formation is there. There is Hutch's classification classifies ovarian disease as ovaritis. That means inflammation of ovaries, ovarian neuralgia, and ovarian dropsy means cystic, and this cystic disease there is a cyst formation. Causes of ovaritis and their modern parallels are there: sudden suppression of menstrual flow, mechanical violence, and irritation of imaginogens is most common. This is the Hutch's concept. Next slide, please. Again, there is a or classification are there: organic, sympathetic, and functional. Inorganic, local disease of the womb is present. In sympathetic, appears secondary to the systemic disease, Bright's disease like Bright's disease, tuberculosis, uh, and lead poisoning. Functional, a poor functional disturbance with no organic lesions. PCOS predominantly falls under the functional category, frequently with organic complication. This like so that this classification guides remedy selection as at a deeper level. Now individualization, that is main soul or core of homeopathic treatment. Uh, there is some common medicine, homeopathic medicine that covers PCOS. How we can select simillimum, that is on mental, physicals, and particulars that makes totality of symptoms, and from this we select simillimum. Some common medicine are there: calcarea carb, sepia, and pulsatilla. How calcarea carb covers PCOS? So in calcarea carb, there is a uh, obesity, fair, flabby, chubby constitution and appearance are there. Also, that covers irregular menses plus cold constitution. Patient is very chilly. So some symptoms are covered in calcarea carb. Second, sepia. The main sensation is bearing down sensation, indifference to loved one, and solo skin. And also it cover mood swings and anger. Third is pulsatilla, that is mild weeping disposition. Also also cover mood swings. The one sentence for pulsatilla is uh, that uh, the symptoms are changes fastly, and changeable symptoms are there, worse by heat. Also, pulsatilla cover delay and scanty menstruation, symptoms that frequently change and better in open air, worsen by heat. Now, clinical approach to PCOS. According to this presentation, the management of PCOS follows 6 important clinical steps, uh, depending. Step 1, in homeopathy we have main core of treatment, that is detailed case taking. Case taking is the foundation of homeopathy. We collect all details and information regarding uh, patient, like menstrual history, nature of menstrual flow, duration of cycle, pain, leukorrhea, mental symptoms, emotional reaction, general physicals, family history, past illness, etc. A complete case providing the foundation for accurate prescription. Also, miasmatic assessment. After collecting all symptoms, we determine the dominant miasm. This help us to understand the chronic background of the disease and support remedy selection. And third main part is repertorization. The characteristic symptoms are then converted into repertory rubrics. The repertory helps uh, identify remedies covering the patient's symptoms totality. Repertorization only narrows the choice. The final decision is always confirmed using by the materia medica. Also, selection of rubrics is important. Then after repertorization, selection of simillimum is there. The remedy most closely matching the patient complete symptoms picture is selected. Remedy is known as the simillimum. The simillimum aims to stimulate the body's self-healing mechanism and restore balance. Now uh, comes to potency selection, that is depends on patient susceptibility, age, vitality, nature of pathology, and chronicity of disease. And as I mentioned in presentation, of next step is follow up. During follow up, we were assess the menstrual regularity, improvement in all over symptoms or disease picture, reduction in physical features, emotional changes, weight, and some laboratory investigation, and all over well-being is important. And next slide.
We have
Monica,
2
how many
minutes.
slides more? How many slides many?
Sir, now some homeopathic approach and a case,
Just
one
only
clinical case is remain.
just only 1 minute remaining, so we can conclude here because
Sir, I think half part of PPT is remain.
we can do it in another session on another day. Okay, so that
Okay.
you will don't get bad about the presentation, but these things can happen. It is not your mistake, but you a little bit fumble in the beginning because of the sharing problem.
Okay.
So don't get panic. Everybody has a bad day. That's the reason why you mentioned. Don't. Anyway, we were able to complete the session. We are not simply presenting things here, but we are giving opportunity to all people to build confidence among doctors as well as students, and That's one of the best thing that we can do for homeopathy. So don't feel bad about anything. You can we are confident that you can do in a better way in the future. So get prepared for that.
Thank you so much for giving me this opportunity.
Yes, Dr. Binoy, you can conclude the session.
Sure. Doctor, you had a good presentation, and all the initiatives, uh, all the concepts you explained very well, and the slide was a little bit longer, and you can complete that in the next session. The slides have all the information regarding the PCOS, and the presentation we can continue on another day. Thank you. It's very good session. Thank you from a IFPH standpoint and all the participants. Over to Dr. Danesh.
Yes, thank you, Dr. Minal Arun Trivedi, Dr. Binoy Abraham, and those who attend the English session today. And tomorrow we will have a session from Dr. Sayeda Shah. She is the Associate Professor, Department of Practice of Medicine, Anand Homeopathic Medical College, Maharashtra. So the subject of discussion is menopause, diet, and homeopathy. Hope all of you will join tomorrow. And Dr. Minal Trivedi, please join tomorrow so that you can talk in between, and thereby you can build your confidence.
Sure, sir. Thank you,
So
sir.
hope you will ask some questions tomorrow.
Sure.
All. Thank you all.
Thank you.
Bye. Over to Dr. Mariamma John to moderate the Malayalam session.
Danesh Doctor. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 2146 പ്രതിദിന സൂം വെബിനാറിലേക്ക് എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മുടെ ക്ലാസ് ആരംഭിക്കുന്നതിന് മുമ്പ് ഒരു നിമിഷം ഈശ്വര പ്രാർത്ഥന.